Hey, what is up, everyone? This is Julie here, and welcome to my premier training presentation, Smash That Written Exam. In this presentation, I'm going to share with you tips and techniques that you can use during training, or even if you've already completed your training, that will help you to receive a first-time pass on the written portion of your state's nurse aide certification exam. But before I just want to remind you to smash that subscribe button on my channel, kick that like button on this video and all of my other videos, and don't forget to ring that notification bell so you'll be notified whenever I upload new content. I'm also asking that you show me and my channel some love and support by clicking the dollar icon situated just beneath the chat box so you can purchase a super chat. Your donation to my channel will help me to maintain my channel with creating, producing, and uploading future training content just for you. Okay, so there are a lot of elements that will either make you or break you in the successful completion of your training program and also during your certification exam. But in this training presentation, I'm going to talk to you about only 4 of these elements, which are key elements to you passing the written portion of your exam. The first element is knowledge, right? You have to be knowledgeable of the theory information that your instructor lectures on, okay? He or she is trying to instill in you the foundation of your role as a nurse aide. So this is information that you have to know. And the only way you are going to become knowledgeable is by attending your training regularly and consistently and by paying attention in class. Okay, so you have to pay attention in class and you have to come to class, okay, on a consistent and regular basis. The next key element is understanding. Now, there is a difference between having knowledge and having understanding. You can know a lot, okay? You can know a lot about a lot. But if you don't have a good understanding of that knowledge, you're not going to be able to produce well, right? So the same goes with the written examination. You can have the knowledge that your instructor is instilling in you, but if you don't understand that knowledge, you're not going to get through not only your test in training, but also the written portion of the CEP. Okay, so there is a difference. And the only way that you are going to gain good knowledge is by asking questions, participating in classroom discussion. So you have to ask those questions. And the biggest question, or the most important question that you need to ask, is the why question. Okay. And this leads me to the third key element, which is critical thinking, right? The more you ask why during your training, or even if you've already completed training and you're reviewing your study notes, you have to ask yourself, why? Why is my instructor telling me, for certain situations, the nurse aide needs to do this or the nurse aide shouldn't do this? Why should I check the oxygen tubing? Why should I look in between the toes of a diabetic resident? Why am I doing all this? Because knowing the why will actually help strengthen your critical thinking skills. And basically, critical thinking is a disciplined process of how you actively and skillfully conceptualize, annualize, and evaluate information that you've gathered maybe from observations, experiences, reflections, reasoning, or communication. Basically, critical thinking is thinking about your actions and the consequences of those actions before you make a move, okay? Before you do anything. So, if you truly have a good understanding of the knowledge that your instructor has shared with you, you'll be able to refine your critical thinking skills, right? And this is going to pull you through this written exam. Now, the fourth key element goes hand in hand with critical thinking. It actually aligns with your critical thinking skills because if you have refined critical thinking skills, you are going to be able to logically sequence events, actions, and your responses to certain situations, right? So all of these key elements align with each other. You have to have knowledge. You have to be able to understand that knowledge. With understanding leads you to refine critical thinking skills. And with your refined critical thinking, now you'll be able to logically sequence and order what you as a nurse aide should do, right? Because you will be introduced to questions on the written portion of your CEP where you may have two, three, maybe even all of the answer choices are correct answer choices, but you have to choose the very best answer for that question. And the only way you're going to be able to do that is by knowing that information that's pertained in that question, having a good understanding of that information, having refined critical thinking skills, and being able to logically sequence what you as a nurse aide would do in that particular situation. Okay, I hope y'all are following me right now. I hope you are following me. All right, so those are the four key elements, okay, to your success in passing the written portion of your state's nurse aide certification exam. Thing that you could do is, and I tell my students this all the time, is to categorize your study notes into sections. And the best way that you can categorize is to mimic the National Nurse Aid Association programs categories, okay, pertaining to the written test. So it doesn't have to be as definitive as this pie chart that I've created. I just created this so you can get a basic or become familiar with the basic outline of the written portion of the CEP and what it entails, okay, what the content is. So if you see, the largest portion of the written exam is going to be based on your basic nursing skills, such as infection control, safety, emergency procedures and responses. What else? Your, observations, reporting, documenting, and just technical procedures such as, blood pressure, taking someone's blood pressure or pulse or any other vital sign. That is going to be the largest content of your test. And you're going to have at least 23 questions, okay, in regards to basic nursing skills. You can see with your physical care skills or your activities of daily living, that's the next largest category, right, at 14%. So you're going to have at least 9 questions regarding nutrition, hydration, elimination, personal hygiene, dressing and grooming, comfort, rest and sleep. So it's a really good idea for you to know the content or what content is going to be included on the written exam. So if you take a good look at this pie chart that I have, it gives you the actual breakdown of the content of the written portion of your CEP. And that's really good to know because now you know what you're walking into. Okay, at least you know the content, what's going to be pertained in the written portion of your CEP. So if you want to you know, print screen this pie chart. You can also go to the NNAAP website and actually print out the table that they have regarding the content of the written portion of your CEP. Okay, so this is categorizing, will help you to gain a better understanding, and it's going to help you to connect all of the topics to one another. Okay, if you're so now on the next two slides, I'm just going to share with you different ways that you can categorize this information, or the layout, how you can lay out this information. So on this slide, I basically have just a basic table, and I have 3 columns here. Of course, you'll end up having more columns with all the different categories. But just for training purposes, I'm just giving an example with 3 columns. And so the first column, I have my basic nursing skills. The second column are my ADLs. And my third column is, your role as a nurse aide. So you see under basic nursing skills, I have everything, all the subject matter that pertains to my basic nursing skills, okay, which are infection control, safety, reporting, recording, and technical procedures. Oh my goodness, I have recording and documenting down there twice, and reporting. And then on, physical care skills, you have elimination needs, comfort, hygiene, and nurse aid roles. You have communication, client rights, your laws and ethics. And the laws are going to be OBRA, HIPAA, and OSHA. Okay, those are the 3 main laws that you're going to be introduced to in with the written portion of your exam. And then you have the healthcare team. Okay, what members are included in the healthcare team, what members are included in the nursing team, and what does each team member specialize in. Okay, so you know that PT, physical therapy, specializes in getting that person back to their highest level of functioning. So they're going to be working with strengthening exercises. They're going to be working with them financially, economically. They're going to be, spiritually, culturally. They're going to be working with that person as a whole person. And then on the flip side of the coin, with OT, or occupational therapy, or therapists, you know that this is the specialty that works with the client, with assisting with their ADLs, okay, their activities of daily living, okay. So this is just one way that you can generalize, or generally categorize the different topic matters. Now, if you want to get a little bit more definitive, you can actually lay out your notes, your study notes, in an outline format, okay? And for example, this is just a brief outline for infection control. Well, to have a good understanding of infection control, you need to know what infection control is, right? So that would be the very first mark that I would have in my outline. And you know that infection control is, they're just practices and procedures that are set forth to help reduce the spread of infection, right? And so now the next thing is, okay, well, how can I, as a nurse aide, help promote infection control? Well, we all know that the single most important defense against the spread of infection is hand hygiene, right? So under hand hygiene, now you want to write what steps you can do to prevent the spread of infection, right? And so here I have listed before, washing hands before, during, and after patient contact, when your hands are visibly soiled, after toileting, before and after eating, and the list can go on and on and on. So this is just another method of how you can set up your note taking. Okay. Now, that you do not want to do while you're taking the written exam. And I don't know, all of them are important. I really can't trump one over the other because they're all equally important. You do not, I repeat, you do not want to overthink the question. The question is what it is. Do not read into it your own scenario. Don't start asking yourself, okay, well, what if this or what if that? The question is what it is. Okay, it's not asking you any more, it's not asking you any less. So do not overthink the question. Another thing that you do not want to do is overanalyze the answer choices. As with the questions, the answer choices are what they are. Okay, they are what they are. Yes, you will have several questions on that written portion of the exam as to where all the answer choices could be correct, but you have to choose the best answer choice. This will bring you back to your ability to logically sequence events, responses, or actions that the nurse aide should take, okay, under certain circumstances, okay? So do not overthink the question. Remember, there's nothing but space in between the printed lines, and do not overanalyze the answer choices. The next thing is don't change your answer. Okay, don't change your answer. Too many times people change from the right answer to the wrong answer. And I'm here to tell you your gut instinct is usually correct. Okay, the first mark you make on your answer sheet is usually the correct response. Okay, however, if you are 100% sure that you chose the wrong answer, maybe you realize you read the question wrong, or you really didn't have a good understanding of what the question was actually asking, but now you do, and you're 100% sure that you chose the incorrect or the wrong answer, and you're 150% sure that you know what the correct answer is, then by all means, change your answer. But you have to meet those two criteria. You have to know for sure, you are certain that you chose the wrong answer, and you are certain you know what the correct answer choice is. Okay, if you're still juggling between two answer choices, just leave it alone. Okay, keep the mark that you initially gave it because it is usually going to be the correct answer choice. Okay. And lastly, you do not want to spend any longer than 45 to 60 seconds on any one question. You are given 2 hours to complete, depending on what state you're in, just, on average, a 70 question test. Okay, 70 questions. If you spend only 45 to 60 seconds on each question, you'll complete that exam within the hour. And you'll still have at least 1 hour to complete the test or to review, to review the test and to make sure that you've, marked all answers or all questions on your bubble sheet. Okay. So take your time. You have 2 hours. Take your time. If you get stumped on a question, let's say 60 seconds have passed and you're still on the same question, just put a little tick mark next to the question number on your answer sheet and go on to the next question. And I will tell you this, a lot of times answers to previous questions you'll actually find in latter questions. Okay, so you don't want to spend more than 60 seconds. It's only going to cause you to become flustered, to become overwhelmed, and your nerves are going to start getting the best of you. Okay, so 45 to 60 seconds on any one question If you have not chosen an answer choice after that 60 seconds, put a tick mark next to the question number on your bubble sheet. And then once you complete the test, go back to that question when you review. Okay. All right. So that is it on during the written. Now we're going to get into some questions here. Okay. And I'm going to share with you how you can choose the correct answer choice for the majority of the questions on your on your written test. Okay, and you can use this for any category. You can use it for infection control. You can use it for personal care skills or physical care skills. You can use this technique on your role as a nurse aide, such as communication and client's rights. Okay, you can use this on any question. So let's look at this first question. To ensure the patient's safety before leaving the room, the nurse aide should. Now, after reading this question, and what I've highlighted the focus word or focus phrases in this question. Okay, so you know that we're talking about ensuring the patient's safety before you do something. And in response to this question, that before is leaving the room. Okay, so your answer choices are A, lower the level of the bed, B, raise the side rails, C, ensure the patient's call light is within reach, or D, remind the patient to use the call light if assistance is needed. You can actually immediately eliminate answer choice B, right? Because during theory, you are taught that side rails are really not a safe thing, okay, for a lot of folks, okay? A lot of people have been injured with side rails or with the use of side rails, and some people have even died as a result of being suffocated because they, caught body limbs or their head was stuck in between the side rails. So as a nurse aide, you know that the person can only have side rails raised on a continuous basis if they have a doctor's order. Okay, so you can go ahead and immediately eliminate answer choice B. Now that leaves you with 3 answer choices. And just with looking at these answer choices, they're all correct, right? Because before you leave the room, you want to make sure that the patient's bed is in a low safe position. You want to make sure that they have their call light within reach. And you also want to, remind that patient to use that call light if they need assistance with anything, right? So all of these answer choices are true. Okay, they're correct. However, this is when your critical thinking needs to kick in. Okay, and your logical sequencing needs to kick in. If that patient's call light is within reach, right? And let's say you walk out the room and you forget to lower the bed, but you have placed that person's call light within reach and you've reminded them to use that call light, they're going to call you, okay? They are going to call you. So the most logical answer would be C, to ensure that the patient's call light is within reach. Are y'all following me? I hope y'all are following me, okay? This is how you use your critical thinking and your logical sequencing with these questions, okay? Especially with questions that have more than one correct answer choice. So let's try another one. So this was in regards to safety. Now we're going to talk about infection control, okay? So this question states, a person gets vaccinated. Which part of the chain of infection is broken? Now, this is when your understanding of your knowledge that you gain from your training comes into play. Well, we know that the reservoir is the place or location where a pathogen, okay, we know that a pathogen is a microbe that causes disease, right? So we know that the reservoir is the place or location that the pathogen lives and thrives. Okay, it grows wherever that place may be. Okay, that is what the reservoir is. We know that the portal of exit is a location in that reservoir that pathogen is able to leave from, right? Okay, so either a break in the skin, unintact mucous membranes, whatever the case may be, right? Then we know that the mode of transmission is basically the way or method that pathogen travels from point A to point B. The susceptible host we know is maybe a person or an animal with a weakened immune system, maybe a person or animal that has an open area of skin. Okay, that is the susceptible host. All right. Now, if the person is vaccinated, that actually strengthens their immune system for certain diseases or illnesses. Okay, are y'all following me? So, knowing this and having a good understanding of this and being able to logically sequence these answer choices, you can eliminate answer choice A, reservoir, answer choice B, portal of exit, and answer choice C, mode of transmission. So the most logical answer would be answer choice D, the susceptible host. That is the chain of infection that is the part of the chain of infection that is now broken because that person has been vaccinated. Okay? If you have any questions, please use the chat box to questions or make comments. So let's look at another question. This question states, today is Mrs. Jones's scheduled shower day, and she refuses to take a shower. The nurse aide should. Well, I've highlighted refuses because this is actually this question is regarding client rights. Okay, and so as a nurse aide, and have a good understanding that the person can refuse treatment. Okay, they can refuse treatment. They can refuse certain care. All right. So your answer choices are A, tell the nurse. B, offer to give the resident a bed bath. C, tell the resident that she has to take a shower. And D, call the resident's family. Well, you can automatically eliminate two of those answer choices, C and D. Okay, because you can't tell the resident she has to take a shower. It's her right to refuse, right? So you can automatically and immediately eliminate that answer choice. And then answer choice D, call the resident's family. You're not the one to call the resident's family. Okay, that is going to be the nurse or the doctor. All right. And there's no need for you to call the resident's family at this point in time. Right. But as a nurse aide, just know that it is going to be the nurse or the person's doctor to make contact with the family member whenever necessary. Okay. So those two answer choices you can eliminate. Now you have two answer choices remaining. A, tell the nurse, or B, offer to give the resident a bed bath. Both of these are correct answer choices, but you have to use your critical thinking and you have to use logical sequencing, right? Because if you come and tell me as a nurse, you come and tell me that the resident refused his or her shower, I'm going to ask you, the very first thing that I'm going to ask you is, well, did you offer to give them a bed bath or a wash up, right? That is going to be the first thing I ask you as a nurse. So the most logical answer choice, if you are logically sequencing these actions, would be B, offer to give the resident a bed bath. Okay. And then after you do that, maybe the resident will say, yeah, sure, I'll take a bed bath. Maybe they'll say, no, I don't want to do anything. And then, of course, you would then tell the nurse because we need to know, right? We need to know about refusals. But the very first thing you should do would be to offer the resident a bed bath. Okay? Are y'all with me? Let's look at one more question. When assisting with dressing a client with dementia, the nurse aide should. Now, this is like almost a twofold question because it's dealing with physical care skills, which is dressing, right? And it's also dealing with psychosocial care skills. Okay, you're interacting with someone with dementia. So you have to definitely use your critical thinking on this one, right? Okay. So with the person with dementia, you know that, there may be times where, you have to repeat what you say. You definitely have to be patient and calm because when you tell that person something, it's going to take a while for them to process that information. And it's also going to take them time to process how they want to respond to you. Okay, so you know that you definitely have to be patient. You have to be calm. You have to talk in a, soft voice, right? Because you don't want them to get scared. So we know with this question that you are addressing someone who has dementia. Your answer choices are A, take the resident to her closet to let her choose which outfit she would like to wear. B, call the family to ask which outfit they prefer her to wear. C, ask the nurse. D, select two outfits and allow the resident to choose which outfit she would like to wear. I'm here to tell you this question is kind of sort of a common sense question, also, right? Especially if you are knowledgeable of dementia, you have a good understanding of dementia, and your critical care skills are refined, okay? Um, Answer choice A. Yeah, go ahead and take the resident to the closet, right? Take them to the closet. What are they going to do? They have maybe 12, 15 different outfits in the closet. The person with dementia will probably just stand there looking confused, okay? Because there's so many choices that he or she can make. It's going to be hard for them, okay? So it's going to cause them to be with confusion, right, on what to do or what outfit to choose. B, answer choice B, call the family to ask which outfit they prefer her to wear. Well, you know what? It's not the family member that's going to be wearing the clothes, okay? It's the resident. And guess what? It's that resident's right to make their own decisions, to make their own choices. So you can eliminate that answer choice. Then answer choice C, ask the nurse. Well, let me tell you something, okay? I'm a nurse. I'm a nurse, and I am no way trying to be mean or talk about nurses because I'm a nurse myself. But if you come and ask me which outfit you should dress the nurse aide in, the resident in, I'm going to look at you and say, you know the person better than I do, right? Why are you coming to ask me? You know this person better than I do, and you will. As nurse aides, you're going to know your client, your patient, and your resident better than the nurse. You're going to even know them better than the doctor, right? So now you can automatically eliminate that answer choice. The best answer choice would be D. You select two outfits, okay, from that resident's closet. You bring them to the bedside. You describe each outfit to them. Hey, you have a pretty yellow shirt with blue pants, or you have a pretty red dress. Which one would you like to wear? Okay. And keep in mind, this is what you do during the skill dressing the client with an affected or weak right arm, right? You actually you actually gather two button-down shirts. You go back to that resident's bedside. You describe the shirts to them, and you ask them to choose. Okay, remember, we're talking about client rights. Okay, they have the right to choose or make their own decisions. So, the most logical answer choice would be D. You select two outfits and allow the resident to choose which outfit she would like to wear. All right. So if you go online go online to take practice exams, or if you have paper copies of exams, you want to try to use these techniques. Remember, you have to have the knowledge, you have to have a good understanding, you have to have refined critical thinking skills, and you also have to have the ability to logically sequence events, happenings, responses or actions of the nurse aide. Okay, so I hope this training presentation was helpful to you. Um, so before I just want to remind you to subscribe to my channel, like my videos, and don't forget to hit that notification bell so you'll be notified whenever I upload new content. And again, as always, please support me, support my channel. You can click on whenever I have live streams, during those live streams, or whenever I have premieres during the premiere, you can click on that dollar icon situated just below the chat box, and purchase a super chat. Okay, this will enable me to continue doing what I'm doing for you, right? This channel is for you. So help support my channel, donate to my channel so I can continue to bring you these training videos and any other training content that I can think of or that you suggest. Okay. Again, thank you so much. And I hope you enjoyed this presentation. Thank you. Ciao.